Welcome back, everyone. If you're wanting to get a facelift but are unsure if it can still look natural, look no further.
Joining us now for more in this sponsored interview is Dr. Scott Thompson from Utah Facial Plastics and one of his longtime patients, Carla. Welcome, both of you.
Thank you.
Hi, Carla. Hi, doctor.
Thanks for having
Good morning.
me.
I'm so glad we're talking about this because people are always curious, but there's a lot of misconceptions. So you brought Carla, who's been through it, and then I told you I'm now at my 3-month mark of having undergone the Max Lift, which is a little bit different. We can explain.
Yeah.
But tell us about Carla's journey.
Carla, she was reminding me, I think she said we met in about 2013, right? And just mainly came in asking me for my advice. And I mainly was just recommending non-surgical type things, some Botox, some fillers, some skincare. She didn't have a lot going on. And then she asked me about surgery. And I said, I think it's a little too early to consider something like that. But then in 2018, did you say, or 2019?
When I had the surgery?
Yeah.
No, 2022.
2022.
21, 22.
She said, you know, what do you think about now? And I said, yeah, I think actually we could consider doing it now. And I think these photos show when I first met her, the middle one is just after skincare alone, and then the third one is the facelift. And there's another one that shows the before and after on the facelift much better.
Wow.
Carla, when you talked about jowls,
there's the surgical
before.
result. So you can just see all that heaviness in her lower neck and her face. And, you know, I would argue she still looks like herself. I think she looks very natural.
Completely.
But she's had
refreshed.
surgery.
And so what I appreciate with you, Dr. Thompson, you say before surgery, before we look at something maybe a little bit more aggressive, you say, let's do all the natural things we can do beforehand. And you want the person and the patient to look after surgery, their best self, their natural self. And I see Carla and I'm like, you got surgery? You look amazing.
I have a good doctor.
Yeah. Tell us about your journey and what your reaction is as the results come in.
It's been really rewarding to me to go through this because it's built my own confidence, and I was terrified to do this. You know, it's a big decision to have somebody cut into your face. And I just wanted to be natural. And I think Dr. Thompson, well, I know Dr. Thompson did a great job.
Look at that.
He made sure that I was natural looking and I didn't fit that stigma of
Well, no, it's beautiful. And you do. You look completely natural. And that's one of the biggest questions. You say people want to do it, but they're worried they'll come out not looking like themselves.
I would say that's the #1 concern I hear of people that are considering this surgery is I'm not going to look like myself. They want to look different, but they still want to look like themselves. And I tell them, you're going to not look like yourself for maybe 2 or 3 weeks. You'll look, and here's another one that just kind of similar. You can see the heavy jowling in the face, and then she still looks like her, but she doesn't have all that heaviness in her face anymore. And so I think if the surgery is done correctly and the post-operative care is done well, then you're going to still look like yourself. And it's I would say a fear it's certainly a founded concern, but it's nothing that you need to worry about, really.
Oh, will you talk about ages as well? Because I once thought of facelifts as something that you do way down the road. I'll be 43 tomorrow, and I just did that Max Lift, and that's for something a little bit younger, right?
Yes, typically the Max Lift is for patients that are a little bit younger, but it actually has less to do with age and more to do with just what's going on with your face. You know, I've done the full facelift on very few people in their 30s because they had heavy jowls and they needed that. I've done Max Lifts on people that are much older because of the way they're aging. So it has, and even sometimes people say, am I too old to have a facelift? You're never too old. If you're in good health and you know, I can help you out, then I'm happy to do the surgery on someone even in their 70s or 80s.
Dr. Thompson, also, how important is it to make sure you have a good relationship with the doctor you are seeing, because you are so comfortable to talk to, and I think that also takes away 90% of the fear of making sure your doctor knows exactly what you want.
Yeah, I mean, I think that's critical because you're going through a long process from preoperative to surgery to afterward. You're going to be interacting with that doctor for all of that time, and it's really important that you're comfortable. And maybe it's not me, maybe it's someone else. You have to be comfortable with that person.
Well, let's just let everybody know that the 3 doctors at Utah Facial Plastics, I think we've all been to, we've all worked with, and you are in such good hands with all of you. Scarring too, you can barely
Yeah, those are
see
some
it.
pictures of incisions, and generally they're very difficult to see. We kind of hide them around the ear and along the backside. And I was looking at Carla's just a minute ago, and you really can't see them
I can't
anymore.
even, it's behind your ear and then along the front
here.
of it, and I can't see a thing. And that perhaps is another concern, is the process of anesthesia and how much pain. And you say, what is the downtime like?
I tell people you're probably going to want 7 to 10 days where you're mostly just hanging out at home. You can work on your computer, but you're going to look a little off, you know, a little swollen, a little bruised. But usually by about 3 weeks, most people are looking pretty normal and getting back to themselves. So.
You know what? It is easier than you think it's going to be.
It is.
UtahFacialPlastics.com to make that consultation today. And I am so glad I did it. One of the best things I could have done for myself. Thank you both.
Thank
and happy birthday.
Thank you.
Happy birthday.
Yeah.
You are our go-to
I'm at the
person.
age where I'm not excited about my birthdays anymore, but thank you.
Thank you
Look
both
great,
so much. And thanks again to Utah Facial Plastics for sponsoring that interview.